fairly large percentage of Americans don't take important medications as prescribed due to issues of high cost and/or low supply. How did we get here? What can we do about it? Thanks in part to support from the NIHCM, that's the topic of this week's Healthcare Triage. In 2024, approximately 21% of Americans report having not filled a prescription because the cost was too high. And around 10% report reducing or skipping doses of their prescription medications due to affordability issues. Results from a 2023 poll suggested that nearly 30% of Americans feel it is either somewhat or very difficult to afford their drug prescriptions. This appeared to be consistent across age brackets, with significant disparities across racial and income categories. Black and Hispanic adults reported more difficulty than white adults. Individuals making under $40,000 per year reported the most difficulty, though 11% of individuals making over $90,000 per year reported struggling as well. A major contributor, at least in the United States, is insurance. According to that 2023 poll, at least 30% of respondents rated their insurance as fair or poor when it came to out-of-pocket costs for their prescriptions. And how do poll respondents feel about the way pharmaceutical companies price their drugs? Not great. In a poll from the Kaiser Family Foundation, only 22% of respondents trusted drug companies either a lot or somewhat to fairly price their products, with over 80% of respondents feeling strongly that pharmaceutical profits are one of the major drivers of prescription drugs, as opposed to, say, pricing based on the value of the drug to consumer health. So what does the drug pricing landscape actually look like? Well, keep in mind that drug companies can price their drugs however they'd like. They can change prices anytime after launching a new drug, and with patents, they're protected from competition for quite a while. Between January 2022 and January 2023, prices increased for nearly 4,300 prescription drugs. Some increased in price by over 3,000%, and nearly half the increases were greater than the increase in the Consumer Price Index, which is a measure of the average change in price over time that consumers pay for goods and services. Basically, this means that drugs are increasing way faster than the rate of inflation. When averaged out, price increases over this year period were about 15%, or nearly $600 per drug. For comparison, prices went up around 11% in the prior year. A review of 2022 data revealed that drug prices in the United States were approximately 2/3 higher than that of 33 comparison countries, with the major factor for this difference being pricing of generic versus brand name drugs. Brand name drugs in the United States cost over 400% of the price charged by comparison countries, whereas generic drugs in the United States cost only, on average, 67% of the price charged by comparison countries. At first glance, you might be thinking, okay, well, at least we have cheaper generics, and that's something. And it is, but it's also more complex than that. Drug shortages, which lead to higher drug prices, are often a result of the fact that somewhere around half of generic drugs result in a profit loss for U.S. companies. This means a lot of companies don't want to take on production of those drugs, and the ones that do sometimes face bankruptcy and forced reorganization or even closure. Thus, the drug supply dips and the prices go up. So what do? Approximately 70% of respondents to a 2023 Kaiser Family Foundation poll did not feel that pharmaceutical pricing was regulated enough. While we might first think that increased legislation would focus on lowering immediate costs, a little more nuance is likely required. For example, to address high prices resulting from drug shortages, government subsidies for generic drug production in the United States could be necessary. This would help create a more stable supply, resulting in more stable pricing. In terms of addressing high-cost drugs, like those brand-name originator drugs, there's been some recent movement in the legislative world. In 2022, the Inflation Reduction Act was signed into law and contained several measures to lower prescription drug costs for individuals on Medicare. The law allows the government to negotiate some drug prices. It limits out-of-pocket spending on prescriptions, caps the cost of insulin at $35 a month, and requires drug companies to pay a rebate if they increase drug prices faster than the rate of inflation. Again, these currently apply only to individuals on Medicare. However, there's nuance to be had here too. Some drugs cost a lot more to develop than others, and thus require higher prices for companies to recoup their investment. This is also true for so-called orphan drugs that treat rare diseases and have less profit potential due to the smaller population of people in need of them. There's an argument to be made that regulating drug prices down without careful consideration of individual factors like these would, at some point, reduce innovation and/or the willingness of companies to invest in research and development. However, given that pharmaceutical companies like Pfizer report net incomes of over $30 billion, and that they often gain a large portion of this profit by using things like secondary patents to prolong their monopolies on certain drugs, there's also an argument to be made that a little more regulation is in order for the benefit of consumers. Drug pricing and regulation is a complicated topic, and one that comes with a lot of money and influence when it comes to political decision making. It seems clear that the U.S. has work to do to catch up with consumer pricing in other countries, but striking the right balance for the right reasons has continued to be an uphill battle. Hey, did you enjoy this episode? You might enjoy this previous episode, which was the second in this series on the factors driving drug investment strategies. You should also watch the first. We'd also really appreciate it if you'd like this video and subscribe to the channel, and maybe go to patreon.com/healthcaretriage, where you can help support the show, make it bigger and better. We'd especially like to thank our research associates, Joe Sevitz and Edward Lillahome, and of course, our Surgeon Admiral, Sam